Good morning, everyone. It's 9 a.m. We'll call the committee of the whole meeting to order. Our chair is running behind this morning due to some weather issues, so you're stuck with me. We'll start out with Historical Society 2025 update and 2026 outlook.
All right, come on up. You guys can come up to the table if you want to, or you can stand at the podium, whichever works best for you.
Okay. What do you think? Podium okay?
Works for me.
Okay. All right. Well, good morning, everyone. My name is Mike Anglin. I'm on the Crow Wing County Historical Society Board of Directors, and we just want to take the time this morning to express our thanks and gratitude for receiving the funding from Crow Wing County. And so this morning, the purpose of our presentation here is really just to provide you with some information in terms of what we accomplished in 25 and then what our goals are for 2026. But again, really, we're here this morning just to express our thanks and gratitude. So with that, I'll hand it over to Hillary, our Executive Director.
Where do I need to aim this?
It should be good anywhere in the room. Let me get you over there.
Oh, okay, there we go. Woo. Thanks. I'm just going to go over a few projects that we were able to complete in 2025. This first one is a Northern Pacific tie plant locomotive that is at the Crow Wing County Fairgrounds. It was in pretty rough shape. You can see the before picture at the top. We were able to get a $5,000 grant for this, $8,500 in designated donations, and over $7,000 in in-kind donations from a local business. The image on the left shows some of the interpretive information that we were able to accomplish so that visitors to the Crow Wing County Fair can actually learn about the locomotive. You can see in the bottom picture what it looks like when it's finished. So we found images of the locomotive when it was first built. So we restored the look of the original graphics. And this project was just featured in the Main Streeter, which is a publication of the Northern Pacific Railway Historical Association that actually has international distribution. Another project we were able to accomplish at the Crow Wing County Fairgrounds was the painting of our District Number 3 schoolhouse and our wool house. The schoolhouse is from 1887. The wool house is from 1905. The paint obviously just helps keep those buildings in good shape for the future. We see a lot of visitors at the fair, so it's important to keep those buildings in good condition. We received a $3,000 corporate donation for the paint and over $14,000 in designated donations from community members. Shifting gears, this is a project that we've contributed to for 3 or 4 years now. Being part of the planning committee for a local Indigenous Peoples Day celebration. Our major contribution this year was to host a traveling exhibit called Why Treaties Matter. That was fully grant funded through the Minnesota Humanities Center. In the upper left, you can see the exhibit at the celebration. In the lower right, that's we moved the exhibit over to the museum to increase the amount of people who could see the exhibit over the month of November, which is Native American Heritage Month. So we engaged over 300 community members, and we're proud to be part of that. Brainerd Ladies Band exhibit. This is a new exhibit in the museum. If you get a chance, come over and take a look at it. It's pretty fun. It'll be featured in Her Voice, which is part of the Brainerd Dispatch. We came up with a fun social media campaign that will be part of Women's History Month this year called Who's That Lady? It features a little more in-depth information about members of the bands. And this is an example of the kind of work we're accomplishing. If we were to have an outside exhibit company come and do an exhibit of this quality, it would be upwards of $50,000, and we completed it in-house for about $250,000. Lastly, I was able to connect with a retired professor of archaeology who specializes in pre-contact Minnesota pottery. And he came to the museum several times over the year and identified over 700 items of pre-contact pottery. It will contribute to a major study of statewide pre-contact pottery. Dates range from 500 before contact era, or before Common Era, to 1100 Common Era. So the piece you're looking at there is about 2,500 years old. And all of this was done for free. Dr. George Hawley will actually be at our annual fundraiser as the speaker, which should be very interesting.
Hillary, what does that mean, pre-contact?
Before Europeans came
Okay.
to America.
And if I can just go back to the previous slide about
Sure.
the Drum and Bugle Corps, what were the years of that?
So it actually features two bands. The Brainerd Ladies Band was created in 1924 and went through the early 1930s, and then the Drum and Bugle Corps was mid-1930s through about 1970, but their heyday was 30s to 50s.
Okay, thank you.
Yes. General information from 2025, we currently have 160 members of the Historical Society. We gained 16 new members this year. I was pleased to see that our visitor amount increased about 25% over the past 3 years. We were pretty consistent. So it increased this year. And we also increased the number of school group and group tours that we had. Another big step we took this year was we have new bookkeeping, which is helping us be more fiscally responsible. New objects in our collection. We had 330 new item donations this year, which shows that people are still interested in donating items. And we're very particular about what we take, making sure that we only accept items that can help us tell the story of Crow Wing County. Those items came from 62 different donors. We currently have a fantastic collections manager. She has a master's in library and information science, and she is extremely efficient, and she also handled a backlog of over 1,300 items that are now in our digital catalog. So they're actually searchable, so it's easier to find for exhibit purposes, and if someone's trying to donate something, we can look that up and make sure we're not duplicating items. The pin that you see there is the same pin on the women in the picture. This was new this year. These nurses were trained at the Northern Pacific Nurses Building. Goals for 2026, we'd like to continue our internship program, which has been funded by Sourcewell. In the picture on the right, you can see one of our interns looking at a panel that was created as a collaboration between two different interns. One did the research, one did the graphic design. We're also going to complete an exhibit on the village of Old Crow Wing. If you're not familiar, this was the first town in Crow Wing County. It's our namesake. And Should be a fun, interactive exhibit, good for children. We're also looking to update our website. If you've been on our website, it's fantastic content-wise, but it's not real user-friendly, and it's definitely not up-to-date. So we're working to fix that, hoping to drive more visitors to the museum. We will continue with collection inventories, making items digitally accessible. We are looking to our 100th anniversary in 2027. So this year we will promote a membership drive, hoping to get new members so that they can be interested in the things that we do for our 100th anniversary. And I am currently working on writing a grant through legacy funds through the Minnesota Historical Society, a heritage partnership grant that will form a new partnership between Brainerd Public Schools Indigenous Education and the American Indian Parent Advisory Committee that eventually will have new educational materials and create a new Indigenous history exhibit at the museum. You want to take over? Financial-wise, you can see we successfully balanced our expenses and our revenue this year. Revenue-wise, you can see county support is still a very important part of our budget, but we are successfully seeking funds elsewhere. Expense-wise, staff is still the major part of our expenses, but again, without staff to do these tasks, that's really what keeps us going, so thank you.
Hillary?
Yes.
Where do you put your, when you receive monies through grants, or like you said, Sourcewell, where do you put that on your pie chart? Where does that go? Does that go under fundraising, or does that go under undesignated donations?
That would be one of the unnamed slices there.
Oh, okay, one of those other three on the top?
Yeah.
Okay.
At our last meeting, you had talked about revenue from memberships and admission. We did a little work to see what we would gain from increases in admission and membership. So you can see the difference between a $3 admission and a $5 admission. It's not significant. We would gain about $1,100 annually. We do see about $1,100 annually just from donations. In our admissions area, we have a donation box. I don't know if that would prevent people from wanting to make those donations if our admission was higher. Still up for debate. Increasing our individual membership, $20 to $25, we'd see about an additional $285 a year. Family membership going from $40 to $50, we'd see about $380. So,
Yeah. Just one thing to note, so this slide is important because it is, we did hear you and we listened to that input and advice at our last meeting. And so we, as a board of directors, are considering those rate increases. And so we understand that that is certainly a way to offset our expenses. So as an organization, we are dedicated to looking into this.
So my question, follow-up question on that then, have you considered what the impact would be, whether there'd be some drop-off in whether it's the admissions or the membership side, if you raise those prices?
Yeah, so we are looking at that, and we're taking that into consideration. We're also looking at other historical societies with their museums too, just to try to see what's out there, what are people doing, what's been successful. And we're really stepping up our efforts in terms of fundraising opportunities throughout the community. There's a lot of great organizations that allow us to be the nonprofit that will be the beneficiary of certain nights like Pines for a Purpose and those things. So we are looking at multiple ways to raise some additional revenue. And so again, this slide we just felt was important because it was input again that we received from you all at our last meeting. And so we did hear that and we are following up on that.
Thank you.
Just one, Hillary, as far as the education you talk about, you have tours or schools come down. How many? I mean, you know, I think it's a big message for, you know, especially kids that, you know, maybe didn't even grow up in here and have moved in here to know the history of Crow Wing. I mean, are all the school districts, do they send, is there like all fifth graders come in, or how do they do that?
There was a huge shift in how many kids we saw for field trips after COVID. Districts have, or mainly the Brainerd District, doesn't have very much funding for busing kids. And they've shifted field trips from being kind of educational versus a fun day at the end of the year. We're looking at ways to get funding for busing kids because we don't see a whole lot of school groups anymore. But it is important. We'd like to see first graders have a history curriculum where they study simply then and now, which what better example than walking through our historic sheriff's residence and looking at an icebox and talking about a refrigerator. So we'd love to see first graders, sixth graders do Minnesota history. Again, they can see locally that fur trade was big in this area. We have all of the examples from their textbook right there for kids to see in real life, which I think is more engaging than reading their book. And then with the high school, they're close enough to walk. They really should at least one time throughout their high school career be able to come over and just be proud of local history and see why this was a great place for people to live.
I think that's something that maybe could be pushed a little more, because I think that's really important.
Yeah.
I know, when you were up here making this presentation, I just kind of do a flashback and remembering going through the Stearns County Historical Museum back, and I don't know what grade that was, but then on sixth grade, we'd go down to the Capitol and take a tour of the Capitol, just to see how it works. Otherwise, we get so disconnected with it, especially with all the devices we have that are taking our attention away. So I think just to see it and figure out a way of making that happen, I think that's pretty important.
Yep. Thank you. This last slide shows a donation that we received this year. It's a penny scale that gives you your weight and your fate. So it gives you a little fortune with that. And it used to be in the O'Brien Mercantile, downtown Brainerd. But thank you again for your time. Please take the time to come over and visit. I'd be happy to schedule something outside of our regular hours and give you a personal tour. It's impressive and worth seeing.
When is your annual meeting, annual fundraiser? When is that date?
It'll be April 28th this year.
Okay. And that'll be at where?
It'll be at Gather on 3.
Okay.
You'll get an invitation.
Well, thank you. Thank you. I get a few of them now.
Any other board questions?
Oh,
Commissioner
good job.
Coring? Yeah, I've got one last question for you.
Nope, nothing
Sure.
from me.
Okay, one last question for you. Can you tell us what your business hours are, open hours are?
We're there Tuesday through Saturday from 10 until 3.
Okay, perfect.
And
Thank
we
you.
are closed for the month of January, but we'll reopen the first Tuesday in February.
Okay, thank you.
Thank you.
Thank you.
Thank you.
All right, now we will have Mr. Danielson, Mr. Pence discussing our updated 2026 fee schedule.
Thank you, Mr. Chair. I'm Jory Danielson, Administrative Services Director. I'd also like to highlight the great work that Hillary, her staff, and the board does at the Historical Society. They allow me to sit in on our meetings monthly and I get to see the great work they're doing on a shoestring budget. Not only do they do a good job of preserving and telling the story of Crow Wing County over the last 150, 175 years, but obviously, as you can see, it goes back much further than that. They also do have the display case down on the first floor. Right now, it's and I'm forgetting the name of it, Hillary, but the hotel, and some pretty cool artifacts in there that help tell the story, so.
Very cool.
Chris and I are here to talk about, next Tuesday, we will be presenting and asking the county board to consider holding a public hearing to make an amendment to the fee schedule. Last week, or maybe the week before, Chris was notified of a license that was issued for low-potency hemp in Crow Wing County, and this is outside of the cannabis ordinance that was established the year prior. So we do have a license that was issued by the state of Minnesota in the Office of Cannabis, and under Minnesota statute, I believe it's 342.22, the county has to register that license and comply with the enforcement and underage compliance checks, similar to tobacco and underage liquor. So I guess I can, if you have any more to add on that, Chris, and what you were.
No, you'll remember we updated the ordinance to regulate how we're handling cannabis uses, and so we regulate through an interim use permit, the retail, grow, manufacturing, and wholesaling of cannabis products. This is outside of that. This is a route that we chose to not regulate from a county standpoint as far as requiring a permit for it. And so we have a situation now where we have a low-potency hemp has been approved by the state, and we just simply need to go through that local process to get it registered and licensed. And there's a fee that is set in the statute, so it's a set fee just like it is for cannabis. If your initial registration is $500, then your renewal every year is $1,000, and then the fee for this one, if I remember right, is $125 for that registration. So it's just simply going through the process of updating the fee schedules so that we can get that information out there, and then we can get that taken care of locally. And this won't be the only, business that will be needing to get this taken care of.
And if you do decide to amend the fee schedule and allow the Administrative Services Office to issue the registration, the state issues a license, we only register the license in Crow Wing County, that we would be able to process it just like we do for the tobacco and alcohol permits now.
Okay.
I think we're required, aren't we?
If you can choose to do nothing, but we still have to do the administrative work and we still have to do the compliance checks per state statute. We just would not be able to collect any fees to help offset those costs.
Well, that makes no sense.
Correct.
All right. I think it's a go. Oh,
Madam Chair, I will yield back to you. Then I'll ask a question if you don't mind. That's just fine. So what are you, I'm assuming you're not looking for anything from us today, you're just bringing this to our attention, correct? Okay.
Yes.
So then this will be on the next meeting?
Yes, on Tuesday's meeting, where you will get to decide if you want to call a public hearing to amend the fee schedule for the county. We will have to publish that notice for 10 days and then have the public hearing, if you so choose, on February 10th's board meeting, where the public can come in and comment, and then the county board can decide whether to amend the fee schedule or not.
Okay, thank you.
Could you give us an update on how many, I know it's a little off the subject, but how many dispensaries do we have actually registered or licensed in Crow Wing County right now?
Right, so in the county, we have one, that's in the county's jurisdiction. It's up in the First Assessment District on 371, just south of BIR. It's south of that gas station on that west side. And so they've received their interviews permit to operate there. They're gonna get what's called the micro business, which allows them to dispense and to cultivate up to 5,000 square feet of flowering cannabis. They can also manufacture and wholesale out of that. And so they're in the process right now. Once they got their interviews permit from the county, then they have to go through a process of getting their license from the state. And so they're in the process of getting all those inspections done and verifying that they have check all those boxes for the state. And then they're gonna circle back to the county, and then we'll have to do that local registration for them as well for 2026.
Now, there's one in Jenkins, right, has that got its license? Is that open?
I
yet?
drove by there yesterday and I saw a sign up, so we don't get involved in the city, so the cities.
Oh,
do
that's,
their-
that's all in city. This is only in areas that are outside of,
Right, so for our jurisdiction is only in those areas in the townships, excluding, not including Crow Wing and Irondale since they do their own.
Right, right.
But the townships, there are some townships that have, if a township chooses to not delegate that registration piece to the county, then the township has to do the registration. So some townships have sent us a resolution delegating that to the county to do the registration for them. We still would do their planning and zoning permitting for them, but if they don't give us that delegation, they're required to do the registration as a township themselves, so.
so do we have, even though it's not in our jurisdiction, it's in the cities, do we know how many dispensaries we have actually open?
As I'm thinking now, I have a little sticky on my computer, so give me a chance to see if I can recall, but I should have brought it with me, so.
You want to run down and look at it
My
quick?
understanding is that there is one in Cross Lake, Brainerd has 2, Baxter has possibly 2 or 3, Pequot has 1, and then it sounds like the Jenkins has 1 as well. So we have exceeded the threshold in our ordinance countywide for dispensaries, so we are no longer accepting intermediate permit applications for dispensaries. There is no cap on the cultivation, manufacturing, wholesaling, and so we've issued a intermediate permit up in Mission Township for a cultivation only. We've issued a intermediate permit in Garrison Township for a cultivation only, and those. So we've had a couple of those, and there's no cap on the cultivation, and we don't have the ability to cap that. We only have the ability to cap the dispensaries and retail locations.
Okay, thank you.
Thank you, gentlemen.
Thank you.
Thank you.
Morning, Madam Chair, Commissioners, Kara Terry with Community Services, and
Richard Grutner, licensed alcohol and drug counselor and chemical health and housing team lead.
so I'm going to share my screen with you because we have a PowerPoint. You might remember a while back, we adjusted the structure of Blade, and it now consists of 4 task groups and a steering committee. The steering committee is manned, the membership is Commissioner Lubke and Commissioner Barrows, representing the county board. And during our meeting last week, we talked about some potential funding needs or funding opportunities for our treatment support funds. Richard's going to present on that today. You did approve a year or so ago $50,000 to be allocated to the treatment fund, and Richard will walk through where those dollars have gone. And then we're looking for potentially an additional $50,000 for this year's expenses. I am in charge of the PowerPoint, which is a really important job. And so get this up and running. And Richard, take it away.
Perfect. You can go to the next slide. In 2024, I think we actually got approval summer of 2024, and first check from this fund went out August of 2024. There was about $12,000 worth of costs that we had covered. We use a model that's basically the application process is very similar to what's called a flex request for the Adult Mental Health Initiative funding that provides supports. So we have a application process that kind of just lists out, okay, what is the need? Why are we needing this? What other sources have you attempted to get funding for to provide for this? And also sustainability. So those are the things we're kind of looking at when we look at those applications. So the first year, as you can see in the pie chart, there was a lot of medication expenses. There was particularly 1 or 2 very expensive medications for incarcerated individual that we were working with at that time. Housing costs is a big one. Counseling services. Just kind of looking at, if you want to go to the next slide, 2025, that tipped a little bit more towards housing utilities. That would include electric, phone, housing. Housing's a big one, and we typically try to run this through what's called ARC. It's a program, federal program, that can provide housing costs coverage for up to 90 days while an individual is in an adult mental health hospital or a treatment program. And it covers also utilities, so we try to run those through that first. A big portion of what we spent on the housing were like deposits for getting into sober housing from treatment and getting into independent housing from that sober house. So a couple different steps in that process, just kind of providing that support, removing those hurdles along the entire continuum of care from the first time we meet with the individual to the time they go to treatment. So how we're breaking down the barriers for our participants. Oftentimes there's additional costs, right? We got individuals that can't get back into counseling or therapy because of past bills when their life was a lot more unstable. So when they've gone to treatment and we start working with them, either case management or another partner agency in the community is working with these individuals, then we provide a way for them to get that therapy and covering bills or for gaps in coverage or, like I said, past bills that hadn't been paid so they can really dig in and start engaging that. Animal boarding is another thing. Oftentimes a hurdle for individuals. We do encourage and ask and try to see if they have family members that can take the pet or check on the animals while they're gone. But sometimes there's just nobody left, so. Storage fees for clients so they don't lose their belongings while they're in treatment. Many of the individuals that we've been getting into treatment and then housing from that have been homeless and are very concerned about their belongings. It's amazing just the capacity of these individuals to be able to survive out there in this kind of weather. And a big hurdle for them is just letting go what little bit they have, right? If they don't know they have a safe place for that. Medication costs is another big area. For individuals that don't have insurance and or they're incarcerated.
Excuse me on that one. When they're incarcerated, I thought the county took care of that. It wasn't our responsibility. But I understand the lapse between the time they leave incarceration and get back on their insurance. I see there could be a window there that they might be not covered.
Yes, there may be a small window there for individuals that already had MA when they went into custody. Oftentimes we can reinitiate that. It's the individuals that come in incarcerated that don't have MA.
And then there are some things that are not covered by the county, or if they are, let me take that back. There are things that are very expensive, injectables, for example,
Okay.
that are covered by the county. You might remember the jail brought forward a program that they're working on with the Department of Human Services for injectables. That's around $1,500 a shot. And so Ron from the jail did come and ask for Blade funding to cover those expenses, which you did approve. But before we did that, we had a couple of injectables that this fund covered before the other fund was put into place.
So kind of like it gapped it over, or at least kept that person medicated or whatever that
Correct.
injectable is.
Yes,
So they didn't all of a sudden just be on medication, all of a sudden go off,
right.
because that could create some real challenges, I bet.
Yes.
It is. Oftentimes, programs that we refer to and try to get the individual into from being in custody need them to be medically stable in many different areas. That could be their physical health. So one individual, for example, that we're working with in drug court was incarcerated. The program was ready to take them, but they had they needed a glucose monitor to be able to go with them because they didn't have that at the facility. Other individuals, they just need to be stabilized in their mental health before a program would take them, and some of those adult mental health medications can be very expensive.
Yeah, thank you.
So some additional things that we've been utilizing these funds for and supporting our individuals is deposits transitioning from treatment or recovery homes. As I already mentioned, rent costs to prevent clients from losing their housing while they're in treatment, vehicle repair insurance to support treatment activities, outpatient employment. I recently did one just for repair work boots. The individual was in one of our sober homes, just come out of treatment, and he was ready to take that next step. He'd gotten a job, but needed work boots. So we provided that, and I believe he's like a month away from being able to get into his own housing again now. Child care costs, so clients can re-enroll their children in child care programs. We had one particular individual needed to be in treatment. The family took the children, the parents did, but they were about to lose their daycare spot because they hadn't been making payments. The grandparents couldn't afford those payments. And so far as I know, this woman's been reunited with her children and working a good recovery plan. Relapse prevention costs not covered by insurance. That is for individuals without insurance, may not have had insurance, or had private insurance that didn't cover very much. MAD panels, transportation, recovery activities are another big area. I think that's it.
Oh, my, then it just goes black. That's supposed to say questions?
The gentleman that you were talking about that you bought the boots for, what's the time frame on something like that where you're, from the time that they come into your program until the time they're on their own in their own house?
That can vary quite a bit.
Yep.
Depending on what they got for recovery capital, whether they got housing or employment opportunities, or they can get a working wage job. So
How
it can
about
be
that
anywhere from, I've seen some people be able to pick it up and start to run with it when they come straight out of treatment, but they usually have housing or a lot of support in the community that can provide them transportation or assistance in accessing those resources or jobs.
How about that gentleman in particular? How long did it take him from?
He was
Start till
in
now.
the sober housing for 6 months when he started to go to work. His outpatient requirements started to diminish, so he was getting stepped down from 4 days a week to 1 day a week. And then he was able to do that in about, 6 months.
Okay.
So when people come and apply for these funds, who oversees that? Who at your office oversees it? Is it just you, Richard, or is it a group, or how do you guys, because you've got to kind of sort it out, because you only got a limited amount of money, and
Yes. So myself and Rachel Zeta, my supervisor.
Oh, okay,
pursue
Rachel,
those
okay.
applications, We make sure, first of all, that we've tried to utilize other resources. Sometimes we'll partner with TCC or another agency in the community. LARC has a meeting, Lakes Area Resource Group. Committee. So we might, pay a portion like $500 towards a vehicle repair or rent, where TCC or one of the other LARC agents will pick that up, the other additional costs.
And that's a group that started, you might remember, during COVID, when all of the COVID dollars were being allocated, and you asked for verification or information on how all of the different nonprofits across the county were coordinating their funds. And so this group was started because of that, mainly around the evictions and housing costs. And now it's broadened to include all sorts of other costs, but it continues to run since back in the COVID days to ensure that coordination.
And these dollars, this $50,000, I guess you'd call it petty cash fund or fund that you're using, that all comes through COVID dollars?
Now it's through the Blade dollars.
Or
that
Blade
you
dollars,
allocated.
excuse me, through the Blade
Yep.
dollars. And I didn't mean
opioid-
COVID, I meant the opiate dollars.
Yeah.
Yep. Thank you for
And
correcting
then
me.
you receive report outs each month when we share the Blade meeting minutes or the Blade Steering Committee meeting minutes. Part of that includes the revenues and expenditures for the opioid funding, and the report on where these dollars go is included in that information, so you can see where those dollars are going. So we're not asking for approval today, because this is Cal, but we're looking to potentially put this on the agenda with your approval for the county board meeting, the next county board meeting. And if you do approve, we're wondering if it could go on the consent or if you would like us to present.
So that $50,000 that you started with, you've run that down over what period of time to where is it at right now? I mean, I'm not asking for to the
There's about
penny.
$6,000 left.
Left, okay, and that's over what period of time?
Since August of 2024.
2024?
Yeah.
Okay, so you've been very judicial, I guess, with how many funds you're having out. So now you're looking at us putting more money from the opiate back into it and bringing that back up again. Okay, thank you.
Madam Chair. Madam Chair.
Yes.
Question, how long can somebody stay in a sober house?
Well, I would love to see them get out within a year. I've seen individuals in there up to 2 years. I think the average, last stat I got from Burlington was right around the 7-8 month mark. With some individuals been staying there in a self-pay capacity for multiple years.
So there's no time limit?
There's no time limit at this time. I do have one of my team members on the DHS work group that's taking a look at recovery residences, will be the new term, rather than sober homes. Just how much oversight and what that's gonna look like and some guidelines, and they're gonna have 2 different level tiers, so to speak, of those sober home or recovery residences. So I anticipate there's gonna be a little bit more oversight moving forward, because DHS is really pushing for it, and they've already started the work group on that.
So that leads me to my next question. Who has the oversight over sober houses? Because I've had somebody complain to me multiple times about I won't say where it is, but it's a sober house. And the cops have been called there multiple times, and nobody seems to ever, who has oversight, or who's going to tell the owner of this sober house that you need to get your stuff together, otherwise we're going to be shutting it down?
Right. I strongly feel that we do need a little bit more oversight, not too much, but some. Department of Health is one that kind of oversees complaints and that kind of sort of thing, but for the most part, there really isn't.
No,
And that's why the big push for this work group and this recovery residence model from the state is to be better equipped to handle this population and provide a safe environment for them to reside, but also with an end goal in mind of self-reliance.
So.
See, here's a
Sorry.
Kara, here's a
I'll just-
perfect example in my mind of DHS being inept, or just is not able to, they're good at just dishing out the money, but there's never any oversight. I just recently went to the Minnesota breakfast. I had Joe Thompson, who was the United States attorney who handled the case for feeding our children. He explained how the money was stolen, and he told this group that I was with that this is just the tip of the iceberg, and there's no oversight. And that's why, as I mentioned at one of our, I don't know if it was at personnel, I think the county board here, we have oversight responsibilities also, and we need to step up our asking questions and our oversight of what we can handle on our end here, because I just think the state is they just don't really give a shit, I don't think, and it really is just troubling to me after I heard this United States attorney tell what's happening, and now it's in autism, and now it's in medical transportation, and it's like a cancer that's stealing the taxpayers' money of Minnesota. And And, you know, God bless the people that are trying to get recovery at these sober houses, but, you know, we've got to be concerned about the neighbors that live by them, and if the police are called a couple of times a week, somehow there has to be some oversight on that, and anyway, I'll leave it there.
I totally agree, Commissioner, and that's one of the reasons why we dedicated one of my team members to visit these sober homes on a regular basis. And Rachel at times is stepping in and meeting with these individuals in local PDs, such as the Jenkins House, for example, as they went through some rough patches and they're kind of changing management. So I totally agree with you. We've been able to provide some support and helping the managers of those homes address issues as they come up. And when we hear about any issues happening in the community, we really want to hear those, because then we can directly address those specific items with the house managers when we do those home visits.
Yeah, unfortunately, also, Commissioner Coring, Madam Chair, we have very little oversight. There's not a lot we can do in terms of removing any sort of agreements. That's done through DHS. You might remember we would bring some forward to you and say, they're looking at putting in a home at XYZ property, and do you guys approve? And if you approve, great. If you didn't approve, well, tough baloney, they still got it kind of thing. They don't necessarily do any of that anymore. And so the oversight is lacking. We, as Richard mentioned, have provided someone to sit on the state committee to develop now some of that oversight, some of the rules and regulations. One thing I will point out, though, is our team with Richard and Rachel and Tammy and the other social workers have built pretty amazing relationships with our sober homes, to the point where we can go in and have those conversations about what we're hearing and what needs to be done differently. We've had conversations around, you know, trying to limit the folks who are in our sober homes to Crow Wing County as much as possible, residents, which they are working towards as well. And the only other thing I'll point out, Commissioner Coring and County Board, is related to our fraud prevention. And as you know, we have a pretty outstanding team. The cost-benefit ratio calculation that we just got last week, I don't know, Debbie, if you had a chance to share that report with them yet, but it was about $1.5 million that we were able to save the county taxpayers regarding fraud claims. One of those, Commissioner, to your point, was medical transportation. And so that we are hoping will go through the criminal justice system, because the amount of money related to mileage claims for medical transportation is pretty significant. Our fraud team is working on a report that will be sent to you quarterly. We are looking forward to coming and explaining it the first time around, so you understand the story behind the numbers, and then we'll see from there if you want us to come quarterly to explain the numbers or what your preference is. But we are working actively on that side of the world as well, unfortunately.
Madam Chair. Richard, you know, you said there's an average of, you're saying 7 to 8 months, as I think you mentioned that earlier. It would be really interesting to see, you know, I mean, we don't need names or anything, and we don't need even really locations. I'm just looking at an overall picture of saying, in our recovery homes, there are this many residents, and some are staying and have that number. I mean, some are almost this is the only place that they can stay at, and they can get the money. We're the conduit for that money that comes through the state, correct?
Yes.
You know, it's not our money, but it is our money. But it comes through this, just to make sure that those recovery homes are it's a recovery home. It's not a place to hide out because you get 3 meals a day and you got a warm place to sleep. You know, I mean, it should move on. If not, you're not really helping.
Yeah, totally agree.
Okay, but I don't need any, I would just like an overall where we're at. And, you know, I'm sure you sit with other counties doing kind of the same thing. It'd be interesting to see where we sit there. So, I mean.
Yeah, I'm not sure about other counties, Commissioner, but I can say we can do that.
Okay. Well, you know, as a comparison, but I know, yes, I would love to see those numbers.
Okay, cool.
Awesome.
You're on that?
Yep.
So would you like, if you are interested in having it on the board agenda, would you like it as a separate item or on the consent agenda? I'm
Presented.
wondering about support for this measure.
I'm comfortable with consent.
I'd like to see it presented.
Since I sit on that board and have seen your numbers and have seen what you've done, I'm okay with it being on consent.
I guess I'm okay with whatever the chair decides.
Let's have it presented.
Okay, we will have it presented and we'll just do the same information that we shared today. Okay, thank you.
Thank you.
Thank you.
Thank you. Thank you, Richard.
Now we're going to move on to the exciting topic of burial policy. So Tina Abertowski is the expert in this. It is not. Okay, there we go. All right.
Madam Chair, members of the board, my name is Tina Ebertowski, and I'm supervisor in income maintenance, and I supervise the adult and long-term care teams. So today, bringing some information forward about our county-funded burial and requesting one ask in here. So, as you guys are aware, under Minnesota state statute, we're required to provide final disposition of deceased persons without apparent means. In our current policy, we have approval for earth burials or the cremation, with the county's preference being the cremation. The cost for that we pay max amount for earth burials, $3,900, plus the transportation, and then for the cremation, it's $2,900. And last year we were here, talked about the medical examiner's fee that is charged to all funeral homes for the signing off of the cremation, and that's a $50 fee. And what is, just to give you a little bit of history of what our applications in 2025 were, we had 77 burial applications, approving 51 of those. Those, the ones that are not approved, that would be for reasons like they had assets that available to cover that cost. It could be property, it could be money in their bank account yet, or if they had a vehicle, something such as that. Also, sometimes it's a lack of follow-through on the family of providing those such verifications of those assets. Of the applications that we received, 62 of those applications were from funeral homes within Crow Wing County, and 15 were outside Crow Wing County. In 2025, we had budgeted $150,000, and what we expended was $137,691. So what we are requesting for a change in the policy is there's been an increase in the fee that the medical examiner's fee is now charging to each of the funeral homes. They've increased that fee the 1st of January of 2026 to $75. And that was brought to my attention by one of the funeral homes in Crow Wing County. So I did contact the Ramsey County Medical Examiner's Office to verify that that fee had increased. So that's what I would like to do, is update that policy to include that fee going from the $50 to the $75.
Madam Chair, so, but only for cremations that's in there. It's not for an earth burial. They don't have that fee.
Correct.
I don't understand that.
So my understanding is anytime that there is a cremation, the medical examiner's office has to sign off on that cremation before it can be done. So if they charge a $75 fee to the funeral homes for completing that paperwork.
But they don't have to sign off on something if it's an earth burial.
Correct. because they're not signing off on the cremation.
Okay. I'm confused.
Madam Chair, Commissioner, I think it's more just a case to make sure that a body isn't being cremated before any other,
Oh, if they wanted to use.
if they needed to
okay.
do something.
They just want to look over and say,
they just
maybe
need to
this
make
is one
sure-
we want to,
Yeah.
okay,
They just need to
maybe
make sure
that's-
that the medical examiner has to sign off on those cremations prior to the cremation happening versus a burial where the body would still be present.
So when they do a cremation like that, if there isn't family members around or somebody to get an urn with the ashes in, what is done with those? What is the, do they just spread them out somewhere, or what happens to that urn?
So I know in Crow Wing County over the past few years that I've oversaw the burials, and when we get those applications, if there's no next of kin, then the county we would sign off for that cremation to happen. And then, we've done very few of those.
And the ashes just stay
And they
at
just
the
stay at the
funeral
funeral
home.
home.
It just stays at the funeral home?
Yep. So no real big changes here. The rest of the policy remains the same. This is one area that we do go around to our fellow counties to see what it is that they are charging, what they have included in their policy, all of that. We're not bringing forward any other changes except for the examiner's fee from $50 to $75.
Madam Chair,
Yes. Go ahead, Paul.
Madam Chair, pardon me?
Go ahead.
Oh, okay. So we're paying for the $75 if it's a county cremation, right?
So anytime there's an application for a burial, if
Right.
they meet that, yes, then we're paying.
So we're paying the $2,900 plus the 75,
Correct.
or we would be paying with the 75. Okay. Okay. Yeah. Okay. I guess I don't have any other questions.
Anyone else?
Would you like this on consent or as a discussion item?
Consent.
Consent, yeah.
Consent.
That's all we have for you today.
Thank you.
Thank you.
Madam Chair,
Yes.
this isn't related to the burial policy, but I did get an email this morning from, if you're okay with this, I did get an email this morning from one of my constituents who, she's just a really nice lady, and she had a question. As long as Kara's sitting there, I'll just read part of it. It says, Paul, if Kara is at the meeting this AM, could you ask her for an update on the closure of the assisted living place that closed, and her department helping out with that? And it went on to a long email, but I guess if Kara, if you don't mind a little update, there is a lot of people that watch these meetings and they're quite concerned. This has concern for their loved ones that might be at a facility, and so I think that's what maybe prompted this, but if you could give a little update, that would be great.
Yeah, so this is for Carefree Assisted Living in Brainerd. Our staff have been doing amazing work, both in helping to hold the facility accountable as well as getting residents placed. We currently have 8 individuals still left at Carefree. 5 of those individuals have tentative placement dates. One has been accepted to a placement. We're just trying to figure out the logistics, so hopefully that person will be placed soon. And one is a bit difficult, so we're working through not only our agency, but also with the courts to work on maybe appointing a guardian to that individual to help find easier placement. So we're shooting for closure date at the end of this month. That's kind of a soft date because it might take a little bit to get a couple of the individuals placed. We have been popping over to ensure staffing levels and things are being taken care of. Did have another bout of COVID, so making sure that supplies and requirements are being taken care of through that bout as well. And then we just had a meeting, gosh, I think it was last week, for our leadership staff to talk about billing the organization for all of our staff time. Because the facility is statutorily required to do a number of things, including making placement plans or case plans for placement, and our staff, while that is a part of the social worker's job to assist in that placement, it is not the social worker's job or administration's job to ensure that those placements are actually happening or being coordinated, and that is a role that a number of our administrative staff have done, as well as ensuring staffing and, like I said, COVID. So we landed on, because there have been a number of staff, myself, some supervisors, we've had case aides who have covered some of that work. We've landed on an average salary of $100 per hour that we will be billing the facility. We're tracking all of the hours of coverage that we have provided since the date we learned about this happening. And I don't have a total for you yet because we're not through this yet. But as soon as we do, I will let you know. There has been some concern that maybe the company that runs it could file bankruptcy or something to get out of the invoice. And what I do know is that they have several other facilities within the state that they're working really hard to keep their licenses for. And so we are one of several. And so I don't know the ins and outs. I'm not an attorney in the realm of bankruptcy, but we will still move ahead regardless of what their decisions are with invoicing for the time. We believe we have a really strong case. We've notified MDH of our intention, and we continue to support the individuals in the facility as best we can.
Thank you for that update.
And I'll follow up on the email as well, Commissioner.
That would be great. Thank you.
Sarah,
Yes.
were most of the residents able to be put in other facilities within Crow Wing County, or was it a farther reach of having to find other locations for them?
I will get that percentage because I do know we have individuals who have been placed in Duluth and in southern Minnesota.
At their choice or because of the fact that we had to find locations?
As much of their choice as could be, right? Because we're limited in is that a good political answer? Because individuals have a choice of where they're placed, if we're really struggling to find placement and Duluth is the only possible option that we can find, and the individual is okay with going there, then we'll sure do our darndest to try and figure it out, but if Duluth is it, then that's it. We do have one individual that is one of our folks that we're having a little difficulty in placing. She wants to stay in the Duluth area, the Brainerd area, and boy, oh boy, we're really working to make that happen. Not sure if it will, but I can get a percentage of in-county versus out-of-county if you would like.
Madam Chair. Kara, is there a lot of, when you start looking to find places for these people, are the places that are out there that we have licensed in our county pretty full?
We've been able to place a number of folks in facilities in Crow Wing County, so we've been really fortunate that way. The facilities have really stepped up, let us know of their availability, and hurried the applications along into their facilities. So we've been really fortunate that way. Where it gets sticky is some of these higher need individuals or of different needs individuals that sometimes aren't the best, to place in facilities. It's just more difficult to find placements. So sometimes it's not a matter of if there are openings, but if the openings are appropriate for the individuals who need placement.
Thank you. Well said.
Thanks.
Kara, are all of the people who are in Carefree from Crow Wing County, or are they from other counties also?
We do have a couple of individuals who we've worked with other counties to get placed. That was taken on by our Crow Wing County staff to work with other county staff on those individuals, and they have been quite helpful, but it's easier for us to coordinate that movement within the county because we are the county, right, as opposed to other counties coming up and doing their work. So up here. So we've worked closely with. Now, that doesn't mean that the other counties haven't called to try and find the placements, which some of the individuals who don't have Crow Wing County case managers have been really responsive. Essentia also holds some of the case management duties for some of the individuals, and I will just say, we're darn lucky to have our Crow Wing County staff working on this. That's my politically correct answer, and I'm sticking to it. Yeah, we're just really fortunate to have the Crow Wing County staff on all of the individuals. Other individuals are private pay, and so they don't have case managers. Some have families, some do not. So we assigned a social worker to be able to help place those individuals as well, or work with them or their families to place too. So happy to have offline conversations at any time if you have further questions.
Thank you. Any other questions? Okay,